Let's talk about something that doesn't make a lot of sense in modern healthcare. A lot of guidelines still tell providers not to take x-rays when patients first come in with low back pain. Here is why that is a problem. Back pain almost never is a one-time thing. About 75% of back pain cases recur over time, and if we're not looking deeper at the spine, we're setting people up for a misdiagnosis. A simple example of this is like a spondylolisthesis. It shows up in about 5% of the population, but you'll never know it's there without imaging. Skipping that step isn't conservative care. In my opinion, it's negligent. So what's the push against imaging? Well, it comes from a dogma called the linear no threshold model of radiation risk, which basically says that any dose of radiation is harmful. But that model has been thoroughly discredited over the years. Modern evidence shows actually low dose radiation from x-rays has absolutely no data linking it to cancer. And in fact, some research shows that low doses may even have protective, beneficial impacts on human health. And remember, we're all bombarded with natural radiation every single day. Here's what else the data tells us. People actually do better when imaging is part of their care. Radiographs help us make a biomechanical diagnosis, avoid missed or delayed findings, make appropriate referrals when it's necessary. We save money by avoiding unnecessary advanced imaging. And most importantly, we satisfy the people that come in. Studies even show that people who get imaging are more confident and satisfied with their level of care. Here's the bottom line. X-rays are not the enemy. Fear of imaging is completely outdated, and ignoring imaging can mean missed deformities, wrong treatment paths, and ultimately worse outcomes. For me, imaging isn't optional. It's a big responsibility that I carry, and because without the clearest picture of what's going on in your spine, I can't give you the best care possible.